skin, and so which is why elderly patients have a lot of wrinkles and wrinkle as we get older. But where else is collagen in the body? Very good. A lot of people tend to forget that. Collagen actually makes up blood vessels. Okay, and so what do you see, those of you who are LVNs, what do you see a lot of your geriatric patients? Well, they're hard to get to, but something else you see, bruising. They bruise very easily. Okay, and so the reason why they're bruising is because the vessels are weak, they're thin because they don't have enough collagen to support them. So they will start to strip and they'll have like these little micro traumas, okay, under the skin. And so that's common. So we don't want to look at them and say, oh, you know, somebody beat them up, or maybe they have some sort of coagulation issue and jump to that. But we just know that that's part of the aging process. However, if you see a child with a number of bleeding and bruising on the skin like that, that's not normal. That's not normal for their age. So is it a possibility that now we have to look into maybe a blood coagulation issue? Yes. Okay. So this is why I just wanted to point out that certain things are different as we age. Okay. Gender differences. What's different between males and females other than reproductive? That's different between males and females.
Muscle mass.
Muscle mass, very good. Males tend to have more muscle mass than females. Females, unfortunately, we have more areas of fat, which is why when men try to lose weight, they can do it, okay, very quickly. Women, it's a little more difficult for us because we have more areas of fat, which means that you would probably not want to give your male patient the same diet, okay, as a female patient. Okay, it's different because you guys are able to metabolize it a little differently. Okay. Situational differences. I always use this example. So, I went to Mammoth to go snowboard. Okay, that was my first time snowboarding. Those of you who ski and snowboard, and that was my first time, you know Mammoth is for the experience. Okay, and I had no business being there. I didn't know how to stop. That was the issue. And I still don't know how to stop. So anyway, I had to make myself fall a number of times. So in any event, I'm a city girl. I'm from New Jersey, also lived in New York. So that was my first time being in that type of elevation. So my body really took a beating. And so I actually had elevation sickness really bad. My heart felt like it was jumping out of my throat. I was lightheaded, everything. So when I was in that type of elevation, what was happening to my heart and my circulatory system? Okay, because of the lack of oxygen, the heart was doing what? Beating very fast to kick out more red blood cells in circulation so I can have more oxygen carrying capacity. So the whole point of telling that story is the body will adapt in certain situations. So in certain situational differences, the body will do what it needs to do to compensate. Okay, and we'll talk about that a little bit more next chapter when we talk about stress and how the body accommodates to stress. Okay, time variations. We'll use blood pressure. Blood pressure is low in the, what time of the day? Well, when you're sleeping, yes, when you're sleeping. What about when you first wake up in the morning? Yes, it's also low when you first wake up in the morning. Hopefully you had a good night's rest. And then as you move about your day, it will elevate, and then as you wind down at night, it should be low. So certain things in your body, very definitely blood pressure does fluctuate, okay, depending on what you're doing and the time of the day. Okay. So, epi, we'll give this definition. So epi, yes, is a study of patterns of disease involving populations. Again, you guys will take a whole course in this and just looking at how disease affects globally. Endemic is native to the local region, so just in one area. Epidemic is spread to many people at the same time. Very good example of this is recent outbreak of Chipotle. Oh, when I saw that, I said, say it ain't so. I love Chipotle. So there is a recent outbreak, I'm sure you guys have heard of E. coli, okay, at some Chipotle locations. And I think they made the announcement yesterday. Did anyone see the announcement of, because they weren't sure exactly where it came from. Did anyone see that? They weren't sure if it was the chicken or the beef or what it was. But in any event, the E. coli breakout occurred at some locations. Many people got sick, and so that's a very good example of at the same time because of that one isolated situation. Pandemic is spread to many people, spread to large geographic regions, so global. So what do you guys know is the most common pandemic disease? Very good, influenza. That is the most common pandemic disease. Okay. So moving on, factors affecting patterns of disease. So we have age, ethnic group, gender. So we talked about those already in geographic locations a little bit. So let's focus just on socioeconomic factors and lifestyle considerations. This is very important. Sometimes people don't address this or don't really look at it and think, okay, well, does it matter how much a person makes? It is important to understand a person's economic background, especially patients that may be coming in, because what can happen is, does this person have enough money to have the proper resources they need for proper nutrition, proper medication? And if not, then there are certain resources that the hospital do have set up to make sure that they can get what they need. Even sociology. So I remember one of the nurses a couple of terms ago, she had gave an example to some of the students in class and said, what if you have a patient that's diagnosed with TB and they live in a household with 7 people? So what's going to happen here, now you have to educate and explain to them what's going on and how to go about, okay, so to make sure it doesn't spread. Lifestyle considerations, I think we already know, yes, drinking and smoking, okay, things like that. There was one study that I looked at a couple of years ago, and it was a section in Long Island, New York, where a lot of women were developing breast cancer. So they were trying to figure out, okay, well, was it the environment or something going on in that area? But the interesting part about that study was this: a lot of the girls in that area start smoking in high school. So now the piece of this is lifestyle consideration. So was it the smoking that caused the breast cancer, or was it the environmental issues? So just keep in mind that lifestyle are important. We talk about that already. Okay. So the last thing we have to discuss is levels of prevention. So we can try to prevent certain disease processes as much as we can, obviously through lifestyle changes and things of that nature. So we'll go over some of these. So they do have different categories. So primary is what we call altering susceptibility and reducing exposure to susceptible persons. A very good example I would put here is education. So obviously educating your patient as to what's going on, how to prevent certain things, okay? Maybe tell them to stop drinking, stop smoking, or whatever it is that's the issue. Even a good example, if a patient has a catheter that's going home with a catheter, instructing them on how to clean it to make sure they don't get infection. Another good thing here, believe it or not, immunizations. You guys will have a good old time getting everything up to par this term with your titers and getting prepared for clinicals next term. And so when we think about immunizations and vaccines, we think about, oh, okay, I'm protecting myself and making sure I'm okay with my flu shot and all that. But understand that when you have immunizations, this is also to protect everyone else. Okay, so it's not just isolated towards you. Now, secondary here is early detection, screening, management of a disease. So this can be any type of annual physical exams, annual mammograms, pap smears, any type of routine exam, even post-op visits, okay, or follow-up visits. And the last one here is tertiary. With tertiary, we have rehabilitation and supportive care to get this patient back to normal function as best as you can. When we think of rehab, everyone jumps to physical rehab, so yes, that is a big piece. But one piece that's missing here with rehabilitation is mental health. From my understanding, mental health nurses are in demand. Yes, a lot of people don't go into mental health. But mental health nurses are in demand, and so with mental health nursing, making sure not only just rehabilitation mentally, but making sure that there's supportive care too. So sometimes not only with just medication, the psychiatrists give the meds, but also psychosocial therapy, cognitive therapy, support groups, so whatever that patient may need. And even not just for like diagnosed mental conditions. In your book, they say that patients that have ulcerative colitis, they even have support groups for that. So it's just a matter of having whatever mental support or emotional support they may need. Another piece that I think could be added here too is actually alternative therapies. I don't know if you guys will take an elective or with this later on, CAMS, complementary and alternative medicine, but they do utilize those things a lot, and I do see them a lot in cancer centers. So sometimes they will incorporate massage, acupuncture, things like that to just kind of help these patients with pain management. So that can also help support in conjunction with their medical treatment that they're given. Okay. I'm done with one. You guys have any questions? Okay. Are you guys okay? Let me go through two. Two is really quick, and then we'll do our assignment, take a break, and do our assignment. You always come in on a good time. Stress. We're going to talk about how your body responds to stressors.
Absolutely. Let me just sit down over there. Move over, honey. I'm sorry.
Yeah. So chapter 2 covers homeostasis and adaptive responses to stressors. This particular chapter, as you can see, your PowerPoint you have is actually shorter. Oh, let me just pick it. Did everyone sign in? Okay.
Monique's on here? Monique Chavez?
Yes, not. Okay. So, homeostasis, you guys had this information with anatomy, so that should be familiar to you. We're going to talk about how your body adapts to stressors, okay? So when we think about stress, yes, we think about emotional stress, but there's also physical and chemical stress too that we'll go over. Okay, let's get right to it. So, homeostasis, I think we know that this is a state in which symptoms are in a balanced and ideal set point to make sure everything is functioning at an optimal point, okay? So pH levels are on the normal level it's supposed to be, blood's flowing in the normal fashion it's supposed to, hormones are secreted in the area they're supposed to. So everything is at a normal, ideal set point for the human body to survive. So that's what we call homeostasis. Now, allostasis is when we have, let's say, well, let me give you the definition. It addresses the complexities and variable levels of activity necessary to maintain or reestablish homeostasis. So this is if your body goes outside of homeostasis. Okay. So say, for example, if pH levels go low where it's supposed to be high, we know that our bodies have buffer systems already in place, okay, to bring it back to where it needs to be. So this falls under the category as allostasis. Another good example how your body maintains homeostasis, if we think about glucose intake. So we know that after we eat a meal, glucose levels elevate. And so instead of your body just keeping it elevated, okay, forever and ever, what happens is that glucose actually gets taken up by the liver and the muscle cells, gets stored as glycogen for later use. Okay, so the body knows what to do to make that happen, and also insulin is kicked out to level it out. So this is a process, again, that falls under the category of allostasis, so we can maintain where we need to be. Now, stress. Stress, physical, chemical, or emotional. Factor results in intention of the body or the mind. So true. I think we all know that when, and I'll use emotional stress as an example. One thing that I always tell people, when you have emotional stress, understand that it's there, it's not being dealt with. That stress or energy has to come out somewhere. So when a person has emotional stress, sometimes that stress will come out through the physical. Sometimes when people are stressed, it raises their blood pressure. Sometimes stress gives them pain. Yeah, so sometimes it gives them pain. Sometimes stress causes inflammation. So it just depends on how it's going to come out through the body. And sometimes people try to downplay stress and say, oh no, that's not it, something else. But no, sometimes stress can really cause certain physical illnesses. Okay? When we think about, yes, emotional stress, but there's also physical and chemical stress. So say, for example, if you have someone that's, say, doing mixed martial arts. Okay? When I look at that, I just want to close my eyes because it just looks too much, just way too much that sometimes people are doing. So with mixed martial arts, they're doing a lot to their bodies, obviously with sparring and things like that. That can cause a lot of physical stress, obviously, to the muscles, okay, and their joints and things like that. Chemical stress. Let's say, for example, a person that's a drug addict. Okay, so someone that's a meth addict or heroin addict or what have you, by them constantly putting this chemical in their body is going to change certain things like their nerve impulses, circulation, things like that, and now lead into other issues because of that chemical stress. So, we do have ways that your body adapts to stress. Okay, so you all know from anatomy we have what is called the alarm reaction, our flight or flight. Okay, so they call this our general adaptation syndrome. So your body knows how to adapt when it needs to. Okay, so that's the beautiful thing about the human body. We are designed to pretty much try to battle and combat what we need, okay, as much as we can. So flight or flight response is definitely in stressful stimulus to make sure we go back to homeostasis, okay? So understand when we have that flight or flight in that heightened situation, it's not to just obviously a reaction to the stress, but it's a way that the body will actually bring us back to homeostasis where we need to be. God bless you. Another thing here is what is called stage of resistance. Stage of resistance is the activity of the nervous and endocrine system in returning the body back to homeostasis. Now, if I could say what are the two most important systems in the body, I would say the nervous and the endocrine system. Okay. Now, they're all important, obviously, for function. However, you cannot do anything without your nervous system. I think we know that. You can't eat, you can't talk, you can't go to the bathroom, you can't walk, nothing. So our nervous system, we know that each and every organ, each and every system has that neural innervation. So that is definitely going to be part of our response, okay, when it's time to bring back the homeostasis. Endocrine system. Sometimes people don't look at this as kind of part of this, but it is. If you look at the endocrine system, all the endocrine hormones, or I should say not the hormones, but the organs, actually secrete hormones. And sometimes these hormones actually target other organs so they can function and do what they need to do, or secrete more hormones for their area. This is kind of a, I don't want to say a balance, but it is. It's sort of a balance for the body. So if your endocrine system is off, it can actually cause a lot of different conditions. And I think we know that. And even just to kind of add in something off topic, if you guys ever look at, say, has anyone ever heard of like energy healing and Reiki and chakra balancing? So if you look at chakras, chakras are actually the same points are the same endocrine points. So the whole premise behind it is that if you focus on making sure that those organs are in proper balance and the energy there is in proper balance, then this is keeping the body in homeostasis. Okay, so that's the premise of it. And so, which is nice because it is scientific. Okay, and so let me give you an example of conditions that can occur with this diagram here. So you ever heard of the situation where people make a joke sometimes and they say, oh, don't stress me out, you're going to raise my blood pressure. Okay, it's true. You can raise someone's blood pressure if you stress them out enough. So let's say if a person has emotional stress, whether it's from their work or family or whatever is going on, and the hypothalamus will sense that stressful stimulus. Okay, I'm sorry this PowerPoint's fuzzy. So the hypothalamus will sense that stress. Once the hypothalamus senses that stress, it will actually act on the sympathetic nervous system. It will stimulate the sympathetic nervous system, and we know what the sympathetic nervous system does. It gets everything sort of heightened. Okay? So now when the sympathetic nervous system gets activated, in that example of high blood pressure, it causes the vessels to constrict. If we have a lot of blood there, obviously, more blood, constricted vessel, that's going to increase a person's blood pressure. Okay? And that's only because that stressful situation attacked the nervous system. Now, on the flip side, we can have another situation where stress can attack the adrenals. Now, I'm going to give you an example. Have you ever heard of a situation, and for some reason this is more common in females, where you try to lose weight. No matter what you do, you can't get that weight off. Okay, you're dieting, you're exercising, doing everything you're supposed to do, but you're like, what is the issue? I can't get this weight off. What happens is this. Sometimes stressful situations can attack the adrenals. The adrenals can actually increase cortisol levels. When cortisol levels are increased, it keeps that sort of water weight gain. And so sometimes when females are just kind of going through, not realizing that it's purely an adrenal issue. Okay? And sometimes they know it's an adrenal issue too, because along with not being able to get the weight off, sometimes they'll have more infections and things too, because the immune system gets lower. Okay? So, let me go back to this. So let's say they're stressed out again from whatever it is. Hypothalamus will sense that and will start to release corticotropin releasing hormone. That acts on the anterior pituitary. We should know this from physiology, that the anterior pituitary will secrete ACTH. Does that sound familiar? Okay. ACTH will act on the adrenal cortex. Once it activates the adrenal cortex will now start to secrete aldosterone and cortisol. Okay, and so this is what happens here. Understand this process occurs normally. It's supposed to happen so the body can go back to homeostasis. However, if a person continues to have a stressful situation over and over and over again and it's not dealt with, sometimes this can just stay. Okay, those levels will just keep elevating. And now it'll lead to certain elements. Okay. This particular slide, this is another one I should have took out. So, this just actually is a nice diagram going over what's happening with the hypothalamus and pituitary. So basically the same thing that I just explained, but just in a chart format. So if you want to cross it out, you can. If you want to look at it at home, it's up to you. But those of you who are visual learners, I think it'll be good for you. Okay. Now, stage of exhaustion. Point where the body can no longer return to homeostasis. Okay, I know that sounds scary. But yes, this can happen, and I would say a very good example is in some terminal illnesses, like maybe a cancer, terminal cancer, things like that, where the body is trying, but it cannot go back to that ideal set point. Okay. Stressors, we already talked about this. I'm going to read through some of these slides. So we already talked about the different types of stressors. Risk factors we already discussed, so we know that a risk factor is the likelihood of getting that disease, not the exact cause. And so let's focus on this. Catecholamines. Please make sure you highlight norepinephrine and epinephrine and know those for next week. We know that norepinephrine and epinephrine are very important for making sure we, part of the fight or flight response, okay? And so again, that's one response that we use with our stressors. Another thing that I already told you is cortisol and aldosterone, okay, so highlight those. Those steroidal hormones are used in also response to stress. So we will get elevated aldosterone and cortisol to help bring us back to homeostasis. Endorphins and enkephalins, these are endogenous opiates, are pain relievers, or our feel-goods. They raise the pain threshold. So, say for example, you ever slam your finger in a car door and you don't feel it like immediately? Has anyone ever like slammed their finger or cut yourself and you don't feel it like initially, then all of a sudden it's like, oh, you start to feel it. What happens is your body actually raises the pain threshold for that moment, right, at the initial injury, to give it a moment to bring it back to its ideal set point for homeostasis. So it gives it a moment to now get the blood cells going to the area and, you know, get your immune system kicked in, so now we can go to the healing phase. So that happens with that. Now, the immune cytokines, if you remember from physiology, these are just more like chemical mediator type things that go through the bloodstream so we can attract more white blood cells to the area for repair. What you should know here is that your immune system is involved in everything. Okay, so that I do want you to know. No matter what disease process occurs, and especially during a stressful response, your immune system will get activated. Okay, and so sometimes it may get overworked, okay, depending on what's going on, and that's that. Okay. I'll use the same example I always use for this. Sex hormones and how stress affects that. So let's use emotional stress or anxiety, depression, and ED. So when men have erectile dysfunction, if you've ever read up on it, it's actually not a biological type issue. So it's not like there's an issue where it's like a nerve supply or blood supply or anything like that. But studies have shown that it's because when men have anxiety, depression, or some sort of mental stressor, that actually can now lower the hormone level, lower the function, okay, of the penis. So these other hormones here are also secreted during stress response: growth hormone, prolactin, and oxytocin. I'm not going to read these verbatim, but just make sure you study these at home. I'm quite sure you guys went over this in physiology. So make sure you know the function of each one. Okay, growth hormone, prolactin, oxytocin. Okay, now, adaptation, coping, and illness. This is very important because sometimes we know that if we have a certain stressor that we know that can be modified or dealt with, we can remove ourselves from that stressor. So whether it's removing your work environment or removing yourself from the home or whatever it may be, okay? And so sometimes that can be dealt with. However, some things cannot be easily removed. So sometimes you just can't pick up and leave your house, okay, or pick up and leave your job. So what happens, we do have a situation where you can adapt and cope, what we call adaptation and coping. So adaptation and coping, these terms are kind of used interchangeable, but they do have different definitions for them. Adaptation, they say, is the biopsychosocial process in response to stress, whereas coping is the behavioral adaptation. It is both kind of a behavioral thing. So let me give you an example. If we have a person that has emotional stress, maybe one person has a way of coping or adapting with it by meditation or taking a long walk in the morning or whatever it is to calm themselves down to deal with the stress. On the flip side, you may have another person that may adapt with the stress by going to happy hour every day. Okay, so some people adapt and cope with things differently. Another thing too, especially when we talk about like mental disorders and even like some things that go on with geriatric patients, I'll give you an example of my grandmother. She, in the past, had a couple of, or I should say 3 heart valves replaced. Okay, so she had the surgery done, her heart's fine, she's good to go. However, she suffers from dementia and really bad anxiety. Okay, and so her anxiety is really bad. And so what happens, what she does as a coping mechanism for her anxiety is if she goes to the emergency room, that makes her feel better. Okay, so she'll call the paramedics, she'll call and say, oh, my heart. And she plays on this and she knows how to manipulate this because she knows that if she tells the paramedics it's her heart, they're going to take her to the emergency room. So when she gets in the emergency room, she feels better. And that's her way of adapting and coping with her anxiety. It's not a good way. And so that's why I said sometimes it can be positive or negative. However, that's her way of coping. To be honest, I'm surprised her insurance company hasn't kicked her off yet because this happens all the time, that she's running to the emergency room. So people have their ways, and it's a behavioral thing. Okay, that's why I explained that story. It's a behavioral thing that makes him do that. Okay. Distress. Distress is perceived as an inability to cope with a stressor. So sometimes people think, oh, that's it, that's the end all be all, okay? And this is also something that people can also incorporate like an adaptation. So sometimes when they think, oh, that's it, then they could also use it as a positive or negative type of way of coping. So whether they do something positive to help themselves or something negative, like, let's say, you know, people that commit suicide and things like that because they just feel like they can't cope any longer. Allostatic overload, this is kind of the same thing as saying state of exhaustion. So this is where the body is definitely going over and over and over to maintain homeostasis, but then it gets to a point where it can't do it any longer, okay? And so, again, I would say maybe use this example maybe more so for like a terminal illness type situations. Okay. The very last chart here, this is a really nice diagram. You don't have to memorize each and every item on this for next week's test. However, just take a glance at it because a lot of this makes sense, okay? And let's use emotional stress again as an example. When you have stressors, like I said to you before, can cause a lot of physical illnesses and things that can happen in the body. So, hair loss. We know hair loss and even acne breakouts happen when we are stressed out. Okay, the hair can be lost, and not only just hair loss from emotional stress, but even sometimes chemical or I should say physical stress. If you have a person that's on like a crazy diet where they're not eating anything, okay, and not getting the proper nutrition, they will suffer and have alopecia, okay, and so they'll have hair loss because of that stressor to the body. Anxiety, depression, overeating. I have a good example for that. When I was in student clinic, there was a patient, this was her situation. Her husband died, then someone else in the family member died, Then the cat died. Okay, this was all like, I want to say in the span of a month. So one weekend she had invited her daughters and the grandkids to come over for lunch. She made meatball sandwiches and things like that. And so for some reason it canceled at the last minute. She told me she ate 6 meatball sandwiches in one sitting. Now, that in my head, knowing her history, triggered, this is an overeating situation, this is an issue. So then I referred her to where she needed to go. So keep in mind that sometimes these things have to do with, obviously, how people are coping, okay, whether negative or positive with their stressor. Stroke can happen from stress, yes, believe it or not. Hypertension. IBS, irritable bowel syndrome. Sometimes they use this diagnosis a little too loosely, okay, when they don't know what's going on. However, studies have shown that pure IBS has to do with anxiety and depression. Okay, it has nothing to do with your normal flora or anything like that. It's just pure anxiety and depression. So, you guys get the picture. So just take a look at that, and like I said, a lot of that makes sense to you. Headaches, sexual dysfunction, all that. Yes?
Is this in the book?
Yes, this is in the book.
Okay.
Yes. I know it's very tiny. All of the diagrams and pictures from the PowerPoint are in your book. Okay, so